really nice plane line of the joint. Do you see how my hand's in the plane line of the joint? That's the plane line of the joint, and here we go. Just like that, right? This actually, I want to say maybe a student was asking me about this, and I thought about it, and I'm like, yeah, actually, that's pretty darn good. So we did this, and you kind of leaned over here, right? And that works. And actually, I did that for years and years and years. That was the way that I did it. And sometimes I still do. But you can spring here. Now watch this. Oh, how's that ankle? Pretty good? Come in here, spring the joint. So does that mean you can't do this anymore? No, you can still do that. There are lots of different ways to palpate, just like there are a lot of different ways to adjust, right? All right, so anterior glide of the right ilium, compare it to anterior glide of the left ilium. But then we also kind of have to compare it to posterior glide. So you might remember you could put a finger in the joint space. And we're going to lift the ilium, feeling for that iliac motion. Feeling for the ilium, what's it going to do? It's going to extend past that right sacral base. And this is really, I think, very easy to feel. It's really easy to feel. So we're going to come here now. Before, when you guys were in motion palp, you were feeling more for that gross sacroiliac flexion, right? Now we're going to kind of spring the joint, though. We're looking more for that hard end feel. What does a bony restriction feel like?
Block of wood.
Block of wood, exactly. So here. Now, am I going to be able to tell which side's restricted if I'm like, no, it's going to be kind of hard. So what we can do is leave the back of your hand on the table, lift your fingers, and then gently spring. Right? Do the same thing over here. And compare that right to left. Usually when this is restricted, it is super obvious. All right, that's the anterior and posterior glide of the ilia. Then we can come in and check all the sacral motions real fast. I'm going to do that with a one-handed contact. You guys learned two-handed contacts. Why? Because it can be a little bit easier to feel when you stabilize the other side of the joint. Does that make sense? But the body weight is typically enough in most adults to stabilize. Go ahead and try this. If you have a hard time feeling it with one hand, go back to your two-hand contact. But the more practice you get, you'll probably be able to do it. Good. But it's still nice to have that two-handed. I've been in practice for 23 years. I still palpate people where I'm like, I don't know, right? Right? It happens. It happens all the time. So you want to have different methods that you can use. All right, so when I come in to check the sacrum, I'm going to go itis tissue pull up to the base. I'm going to spring into nutation. Tissue pull from the middle to the apex, spring into counter nutation. Now I'm going to check around oblique axes. I can go right sacral base to induce rotation around the left oblique axis. And for all of these, your tissue pull is really just from the center of the sacrum. So again, that could have been like 30 letters for you to memorize. Or if you know how to describe to get from the center of the sacrum, you just learned 6 different tissue pulls. That's it, right? So what would my tissue pull be to get to the right sacral base? Huh? I to S medial to lateral, and I am touching my patient from the posterior and P to A, right? I to S medial to lateral and P to A. Good. So I'm just going to come in here and then spring the joint, come in here and spring the joint. Compared left and right base. So this is rotation around the left oblique axis. If that was restricted, I could have a rotation restriction around the left oblique axis or right sacral base posterior. Come in here, left sacral base, spring the joint to check for rotation around the right oblique axis. If that was restricted, it would be a rotation restriction around the right oblique axis or a left sacral base posterior superior. Exactly. Now I'm going to check apex tissue pull from the center of the sacrum. I to S medial, not I to S, S to I medial to lateral and P to A to the right sacral apex. Spring the joint. And I'm checking for counter rotation around the right oblique axis. And then come in here and spring the joint and compare those to each other. So real quick, when I'm assessing the pelvis, done.